Hearing loss is one of the most common conditions affecting older adults. As a matter of fact, 1 in 3 people over the age of 60 and nearly half of all people over the age of 85 are experiencing hearing loss. Hearing problems can make it hard to understand and follow a doctor's advice, to respond to warnings, and to hear doorbells and alarms. They can also make it hard to enjoy talking with friends and family. Working one-on-one to resolve hearing issues is a source of pride for the audiology team at Lake Ear, Nose, Throat, and Facial Plastic Surgery. You don't have to take our word for it, though. We spoke with one patient who told us about his experience.
Well, when I moved to Florida from California, I had some hearing aids that became all corroded up because they weren't used to high moisture, and I ruined a set. So I had gotten another set from another office, and they just did not seem to take care of the problem that I wanted, and the service of them that I wanted. And so I had heard of Lake Ear, Nose, and Throat, and so I'd go there and see about it. So I went there and saw a page about it and have been quite happy with that ever since.
A very important part of recommending hearing aids is learning about the lifestyle of the individual. If you are someone who's at home, then you probably don't need one of the more moisture-resistant type of hearing aids. But if you're a very active individual who's out dancing, playing golf, more actively involved in the environment, perspiring, then we definitely need to make a choice that we're going to select a hearing aid that can resist moisture and the problems that we could have more so than others.
Paige is very personable at taking care of your problem, and not, many of the people in the hearing aid business, I think, just really want to sell hearing aids. And Paige takes a different approach to that. There was no pressure. It was just a nice experience not to be pushed into it, because they are, it can be an expensive item to buy, and if you're going to spend that kind of money, you need to know that they serve your needs the best they can. And she did all of those things. Let me try them out and tested them, and we tried some other ones, tested them, and then took her time and purchased these that I have now, and I've had these for over 5 years. But more than that is the follow-up that she does. I try to see her about every 6 months, and that was included in the cost of buying them, that she doesn't give me a big service charge to come in every 6 months to do that. She checks them, and periodically we do a hearing test to see if it's changed, and it has. And she's taken care of that by modifying what these hearing aids can do. She has actually reprogrammed them. She's been very, very good about it, of addressing my problem and fixing that and trying to make those work the best she can.
There are many different hearing aids to select from. We're not going to be stuck with one particular brand. There are different levels of technology, and to say that you have to spend $5,000 or $6,000 on a set of hearing aids would not be accurate, because we do find that most of the time we can help people with considerably less cost. Most of our patients are probably on the second tier hearing aid technology, and they're relatively comfortable with that cost. Success with my patients would be having a smile on a face, having someone say, I wish I would have done this years ago, I can't believe how well I'm hearing, or just simply putting a hearing aid in and seeing for the first time their significant other, their child, their spouse say, you're hearing me, and you were not hearing me an hour ago.
For more information on hearing aids and the audiology services available at Lake Ear, Nose, Throat, and Facial Plastic Surgery, please click on the Hearing Better story link on our homepage at yourhometownhealth.com.